Good morning, everyone. My name is Jen Dwyer. I'm the medical director for NextSense, and I am honored to be here today to tell you about our technology and how it fits into what we see as a new paradigm in neurocare enabled by unobtrusive brain monitoring. I am here with my colleague, Jonathan Barrett. He's the CEO of NextSense. He's sitting over there on the side. He goes by JB. And please feel free to reach out to either of us anytime today or anytime after the conference as well. NextSense aspires to be the foundation of brain health and establish a new paradigm in neurocare. So what does this mean? Well, we believe that neither the currently available health tech wearables on the market nor the traditional med tech innovations really hold the key to unlocking brain health for all. So our approach is to develop a new category, a medical grade yet consumer facing or oriented platform that will improve clinical care for people living with epilepsy, other neurological conditions, and impact anybody who's interested in improving their own individual brain health. So there are two cornerstones of the NextSense Vision. One is EEG-enabled earbuds, which allow for unobtrusive longitudinal brain sensing. And I'm actually wearing the earbuds right now. For full disclosure, I am not actually currently recording, but I could be recording my brainwaves during this talk. And then the second is data-driven insights with the help of machine learning AI. I'd like to pause just for 10 seconds and for just a bit of shameless self-promotion and hold up this latest issue. It's the June 2022 issue of Wired magazine. If you have a chance to pick a copy up in the airport before you head home, there's a feature-length article about NextSense. It starts about on page 68. It goes into our origin story. We were just really thrilled that Stephen Levy was able to tell our story, and we just think it's really fantastic that Wired is interested in brain health as well. So please pick up a copy and let us know what you think. All right. Over the last 5-ish years, we have developed novel brain sensing earbud technology based on a form factor that hundreds of millions of people all over the world are intimately familiar with. While this bodes well for population level adoption, what's super important to us is that it provides a non-stigmatizing form factor for longitudinal remote patient monitoring. The ear canal is also a prime location for sensing EEG due to its anatomic proximity to the temporal lobe. It's essentially an easy access portal to the brain. So our earbuds collect clinical grade EEG, and you can see on the slide an example of seizure onset simultaneously recorded with a clinical EEG system as well as the NextSense earbuds, and then also an example of N3 sleep or slow wave sleep. It turns out that we can also extract other relevant physiological signals from the in-ear sensors, including electrooculographic activity, cardiac EKG, and muscle EMG. The NextSense platform consists of our biosensing earbuds, a companion mobile app, cloud-based database and analytics pipeline, and a clinician-facing dashboard. In addition to EEG, the earbud device has a triaxial accelerometer for collecting motion information and a physical button for event marking capabilities. The earbuds connect via Bluetooth to NextSense mobile app, which among other things includes or will include medication tracking, seizure event and sleep diary functionality, other clinical assessment instruments, and also we hope the ability to upload video of seizure events. We're also in the process of building out a HIPAA compliant cloud-based data storage infrastructure, which loops into our analytics pipeline for pre-processing and quantitative analysis. Our research and data scientists are working hard to implement algorithms for automated seizure detection and sleep staging, which will eventually feed into the goal of providing insights into longitudinal trends. And then lastly, our externally facing clinical dashboard is being designed to provide clinicians or research partners with a summary of seizure events and the ability to visualize individual EEG traces for events, as well as zoom out to see a more longitudinal view of event trends and associated biomarker correlation trends. So we have been validating our earbud EEG against gold standard EEG in a number of clinical studies, primarily so far based in the inpatient EMU setting. So participants have been patients who were referred for EMU admission as part of their usual clinical care for either pre-surgical or diagnostic continuous EEG monitoring. And we have asked them to wear the earbuds alongside their clinical monitoring. So far, we've collected simultaneous intracranial EEG plus ear EEG for 8 patients and simultaneous scalp EEG plus the earbud EEG for 12 patients. And this amounts to over 1,000 hours of recordings. We then had 2 expert epileptologists blindly label the ear EEG for seizures. And subsequently, they blindly reviewed and labeled the intracranial and scalp recordings. Here are the results. So 84% of all focal onset seizures that were observed on the gold standard system were also detected by blinded expert visual review of the ear EEG. For focal onset temporal lobe seizures, our accuracy was even higher at 93%. And for focal onset to bilateral tonic-clonic, accuracy was 100%. Of the 11 total patients who actually had seizures during the monitoring period, at least 1 seizure was correctly identified on the ear EEG per patient. The false detection rate was quite low at only 2 over the course of 1,128 hours. We had nearly equal representation of seizures occurring during sleep versus during wakefulness. And 75% of subclinical seizures were accurately captured on ear EEG. Here's an example of a subclinical seizure that was recorded during sleep. The blue traces represent activity from a select number of intracranial EEG channels, and the pinkish reddish traces are from the ear. The box in the upper left is a zoomed in view of seizure onset, where you can see the stereotypical seizure waveforms, very nicely visible on the intracranial as well as the ear channels. Down below, there's a 30-second window showing clear evolution of high amplitude rhythmic activity, followed by post-ictal slowing. You may be able to see the very faint yellow trace at the top, and that's from the accelerometer. In this case, it's really just confirming any lack of confounding motor activity during this particular seizure. All right, so we have a lot of things on our roadmap, and these are just a snapshot of some of them. One big thing that is missing from this timeline is that we do actually expect to have FDA clearance within the next year. On the hardware side, we're pushing to deploy a universal fit earbud solution in clinical studies within the next few months. And this will enable greater scalability versus our current design, which is a custom fit approach. On the hardware side, or on the algorithm side, we are working on automated seizure detection algorithms and sleep staging, with a longer term goal of developing seizure forecasting capabilities. Our near term software focus is on developing research and clinical mobile app versions, as well as building our HIPAA secure cloud database and clinician facing portal. And then we have a more consumer facing app that's a little bit farther down the line. So I think this is my last slide. Thank you so much for the opportunity to present our work. I'm happy to answer any questions.